There is a workshop going on at the moment, and this is headed by the National Cancer Control Program at the Ministry of Health, and it's holding a regional dissemination workshop for Central Rift counties. Bridget Ghana is following up the details on this and tell us the importance of this particular function.
Well, Mark, as you have mentioned, cancer is one of the leading causes of death in terms of non-communicable diseases in the country, and thus the National Cancer Control Program was put in place last year in July, and we are going to be speaking with Dr. Nganga, who is chairing the National Cancer Control Program, and these regional workshops that they have been conducting have been a stream of dissemination and also information gathering initiatives by this Cancer Control Program, so as to get a sense of what is really happening in terms of incidents of cancer in this country, and more specifically how we are responding to this issue, because cancer is a disease that really takes a toll on the treatment or also even on the families in terms of how their kin come to find out about it. And so this is a session that is focusing on improving the cancer care in this country. So Dr. Nganga, thank you so much for joining us on a brief notice. Just give us a view of what exactly have you been doing around the country in the times that you have been holding this dissemination workshop.
Okay, thank you very much. We developed the National Cancer Control Strategy last year and launched it in July. So one of the things that we decided to do is that we must tell the counties what is in the National Cancer Control Strategy, so they're able to understand their roles and our roles as national government. And so we've been going around all the counties, and today is our last meeting. We're meeting the counties from the Rift Valley region. So we've gone around the country and talked to each of the counties, and each of them now understand what their role is. They understand the cancer burden in the country, and then they're able to prioritize cancer control in their respective counties.
We're talking about cancer treatment at a time where their incidences are really rising, like year by year, as various countries have been able to speak with you, are telling you they've been recording an increase in the number of cancer cases in the various county hospitals. Maybe from your point as the program that will be managing cancer, where is it that we have been getting it wrong, and where will it now from now on be getting it right in terms of early detection and screening and all the works behind the cancer treatment?
Yeah, one of the greatest challenge we have in cancer is patients coming late. So one of the things that we have decided to do in this strategy is have one pillar that talks about prevention. And in prevention, we're looking at screening and early detection. So we have decided that we're going to have a national cancer screening program where patients, people actually can go for screening, because screening is for those people who are not sick yet. So there's a very strong pillar on screening, and we'll be developing those cancer screening guidelines so that the counties then are able to screen, because screening, you know, is a service delivery, and that's a function of the county. But then as a national government, we develop the policy to guide them on how they'll be doing this screening. So we hope to have more screening, we hope to have more early detection, so we have patients coming earlier when the disease is not advanced, and at that time then even the treatment for that early stage disease is much more manageable.
We're talking about developing a strategy, a national cancer control strategy. Just tell us how will this strategy maybe help us, and also in terms of understanding the cost of treatment of cancer, because one of the questions I asked you off the cuff was, isn't it because people are fearing the cost of treating cancers, that's why maybe they may not be getting screening earlier enough?
So one of the things that a national cancer screening program guideline would do is really to tell the people about the need for early detection. If you have a cancer that has not even started developing symptoms, the treatment for that is really, really manageable, even in terms of the medical, procedures that need to be done on you. And so that brings down the cost, and that's why we're saying we need this screening guideline to be disseminated to all the counties and let the people know the need for early screening. I know you've talked about people not wanting to come for screening because they think then cancer treatment, first of all, cancer diagnosis is death and the treatment is a lot. But if then you're screened early, and we have cases of people, we're using champions who will come and tell their story and say, I was diagnosed at stage 1 and this is what I paid for treatment. treatment, it is manageable, and now I'm alive and well. So using champions, using the screening guidelines, and really giving people information. The reason people are scared is because of really probably lack of information. But if you give them correct information, then they will see the need for early screening and know that cancer diagnosis does not equal death.
Before I let you go, Dr. we have issues. We're talking about prevention, we're talking about early detection, we're talking about treatment, and we're talking about palliative care. Even as a country, we also have to invest in terms of research. So are there maybe insights towards maybe the strategy also focusing on cancer research? Maybe can we also be one of the leading countries in Africa that are championing cancer research and treatment?
Very good. Now, in our strategy, we have one pillar that's actually focused on research. This strategy was developed using a multi-sectoral approach. So we had people from the academia, which is the universities. We had people from the tertiary institutions like Kenyatta Hospital. And so really, we have a team of people who can guide the research. So in our pillar, which is the last pillar, pillar 5 of our strategy, it focuses on monitoring, evaluation, and research. So we are encouraging research because we talk about evidence-based policy formulation. So we want to be able to generate our own research. So we have a whole research agenda in our strategy, and working with those institutions, then we'll be able to carry out research and get our own evidence that will guide our own programming locally. Yeah.
Thank you so much, Dr. So, Mark, those are just the insights that are being generated from the National Cancer Control Program. They have been all over the country trying to get information from the county hospitals. You remember that health is a devolved function, and so they are going to the counties where these incidences are first recorded before they're even referred to other more bigger hospitals, you know, that like the Kenyatta Hospital or maybe other county referral hospitals that are known to be treating or managing cancer cases. And so they have been touring the country. They have been able to get information, gather information, and that's why Dr. is here. She's saying that what is needed is the information that will help them come up with a strategy that will help prevent incidences of cancer, detect early the cases of cancer, and also reduce the treatment costs that is associated with cancer that is detected as the later stage. She has also mentioned the issue of building the capacity of the existing healthcare workers who are dealing with cancer, or specialized healthcare workers when it comes to cancer, because you know we also have a shortage of oncologists in this country. But this strategy is also going to bridge that gap and help this country work in unison, or work towards ensuring that cancer is no longer one of the leading causes of death in terms of non-communicable diseases. Mark.
It's Ngana, thank you for that, and definitely something that we need to keep a close eye on. Many families affected, many Kenyans are directly affected and losing their loved ones, and such interventions need to be done and given the platform, of course, national platform that is not just for the region, but today the focus is on the Central Rift counties.